The main challenge is to get the workforce to be more accountable and more efficient and to deliver greater value for money. And by greater value for money, what I mean is higher quality at a lower cost. The financial challenge is absolutely immense at the moment, but the clinical challenge, the quality challenge is also immense at the moment. And what we find is that the work that we've done has identified kind of great leaders who are using the flexibilities within the system to the extent to which they can, and they feel that there's only so far that they can go. And great leaders build fantastic teams, and they get the wonderful satisfaction out of their staff, the doctors and the nurses and the other healthcare professionals, but they also get the best results for patients, the highest quality of care. And so it's really interesting to kind of talk to the people that are doing it at the cutting edge, as it were, and they're constantly saying that they are they're sort of wrapped around by the ivy of the contracts, the agenda for change, the consultant contract, and in the case of clinical commissioning groups, the GP contract, which they don't even have any control over for negotiation at a local level. And so if these contracts are a barrier, then we need to do something about that. For a start, we need to kind of celebrate the ones that are great. So, the hospital leaders, the GPs, the social care leaders, at every level of the system, we need to kind of root out the really good ones and show that that is the kind of performance that we want in the system. But we probably need a number of things. We need a failure regime for poor performing organisations so that we can send out the signal into the system that it's not acceptable to deliver poor quality care. It's not acceptable for my mother or your mother or anybody else's mother to be treated poorly in hospital or in a nursing home or anywhere else, and that something will be done about that at a cultural and institutional level. It then is about teams and leaders becoming sort of taking pride and wanting to achieve excellence, not ever standing for mediocrity, because mediocrity should never be good enough. There is always going to be a 20% in the middle, but that 20% should be striving for excellence all the time. And frankly, at the bottom end, being completely intolerant of failure and of poor performance.